Hi, I'm Dr. John Raymond Baker. I'm a chiropractic doctor in Longview, Texas. Today's March 23rd, 2014, and I wanted to speak to you a little bit about what I see as a troubling trend. The troubling trend is that I've seen insurances, after someone is in a car wreck, approach the injured party really quick with a check in hand saying, hey, let's settle this case really quick. And a lot of people, because it's tough economic times, are thinking, well, if I can get my car fixed and get a couple of extra bucks in my pocket, it's all good. Well, it might not be all good. Now, you have to consider one thing. The other side's insurance company is not your buddy, not your friend, not your pal, and they don't really care how badly you're hurt. They don't care if they give you a couple of bucks and you're hurting for the rest of your life because of that wreck. All they look at you as is your red ink, your liability, and they want to minimize that liability, so they want to pay you off as quick as possible. And frankly, a lot of times they just look at you like, well, we can pay him off for $2,000, or we can pay him off for X number of dollars. He doesn't know how badly he's hurt, so get in there quick, get it over with, get him to sign the bottom line. Because if you sign that line releasing them from further liability, doesn't matter how bad you're hurt, doesn't matter if you need surgery, it doesn't matter if you need 20 years of care, doesn't matter if you can't bend your neck, you can't turn over, you can't bend over, you miss so much time from work that you get fired. Their liability is limited to whatever they pay you once you sign that agreement. And they know that, because they do this for a living. You don't. And if, for example, let's say you go to the emergency room. Most emergency room doctors are going to evaluate you for life-threatening injuries. Whether you have a brain injury, something that they're going to be responsible for immediately. Contusions, lacerations, you know, that kind of thing. They don't look down the line and say, well, he's lost the curve in his neck, he's lost the curve in his back. That may lead to osteoarthritis, may lead to crippling problems. You know, they don't think about that. They think about, is he going to die? Is this something I have to treat right now? If not, they're going to let you go. And if you've been to the ER and they say, oh, you're free to go, you think, well, I guess I'm okay, and the insurance company shows up with a check and you're ready to go. Now, what they don't want you to do is they don't want you to go to a doctor to be evaluated by someone who has many years in treating accident victims and knows what can happen if you lose the curve in your neck and your low back. They don't want you to talk to a lawyer because they don't want you to know your rights. In short, they don't want you to be an informed client or informed patient. They want you to be somebody that they can pay off, limit their liability, and be done with it. And if you're going to go for 6 months with pain and have developed clinical depression, they don't care. I mean, let's face it. Why would the insurance company, for the person that hit you, that was at fault, why would they care about you? You're not their relative. You're not their buddy. All they see you as is a liability. And I know I'm saying this more than once, but you have to get it in your head. They really don't care how badly you're hurt. And a lot of times, people that get, even in minor car wrecks, people that have neck, low back, shoulder injuries, can often have these things nag on for years. I've seen people with knee injuries, for example, hurt in a car wreck. The knee didn't show up any problems on MRI. They looked fairly normal on the x-ray, but the poor person could hurt for years, 10, 20 years, often can't hardly walk because their knee hurts so bad. And that's just one injury. Just think about what if you're talking about the whole body, shoulders, necks, low back, knees, etc. But again, this is something where the insurance company knows they can take advantage of your not knowing and will dissuade you from getting an attorney, going to doctors for second opinions, etc. They just want you to sign, get them off the hook so they can go on their merry way and make more money. And they don't care how badly you're hurt. So if you're in a car wreck, and this, by the way, this is not just Texas where I'm located, but it's nationwide. So if you're in a car wreck and you don't know how badly you're hurt because you haven't been to a doctor that really, like me, I've done this since 1989, and so I know a little bit about the sequelae from car wrecks, done videos about it, written about it, etc. They don't want you to go to someone like me. They don't want you to go to an attorney, and they just want you to sign. And you'll kind of get that feeling when the adjuster or whoever approaches you from the insurance company is, oh, let's go ahead and get this taken care of and get it settled. You know, you have to be responsible for your own health and for your own safety and for your own future. Be aware that something that you don't know about right now could come back to haunt you, could cause you to have surgery in the future, could cause a lot of things. But don't be too quick to sign. At least talk to an attorney about your legal rights, talk to a doctor, be checked out as far as really what is the extent of your injuries, what can you be looking at down the line, and what are your options for treatment. Thanks for watching, thanks for visiting my channel. I hope you have a good day. I hope you don't get in a wreck, but if you do, kind of think about what I've said when the insurance comes a calling. Take care. Bye-bye.